Hi, my name is Megan, and I'm a research fellow working on the BRAINS program within Psycho-oncology Co-operative research group. Our research focuses on improving coordination of care for people living with primary brain tumor and caregivers, so that people can have access to continuous and timely care according to their individual needs. We understand several challenges people face in navigating their disease, healthcare system, treatment, and survivorship care, because the access to care coordination is not uniform across Australian healthcare settings. To overcome some of these challenges and improve care coordination, we identified existing evidence and clinical guidelines to identify current and novel approaches to care coordination in primary brain tumor and determine key components of care coordination. We conducted a systematic scoping review of research studies, clinical guidelines, and resources related to the framework and implementation of care coordination in primary brain tumors. We identified 1,163 reports from data search, from which we included 30 eligible reports in our review. Of these 30, 13 research studies reported interventions by either describing the development or implementation of clinical guidelines or framework, or describing nurse-led or care coordinator-led models of care coordination in primary brain tumors. Similarly, clinical guidelines and framework emphasize the use of designated healthcare professional as a care coordinator to navigate the healthcare system and medical care for primary brain tumor treatment. Some of the facilitators of care coordination we identified included regular screening and timely intervention for rapidly evolving symptoms and functional declines, healthcare professionals' competency or opportunity to upskill in relationship-based and communication skills, improved access to resources to facilitate informed communication and referrals, and recognizing the carers' involvement and the role of carers in terms of the patient's care and coordination, and recognizing the wide range psychosocial impact on the family. However, funding instability and limited access to care coordination staff outside hospital setting were identified as barriers. Current published knowledge about care coordination is limited to describing nurse or care coordinator-led models of coordination of care. There was limited knowledge about and lack of guidance about what care coordination should entail for these people. So in the next step, we aim to establish a consensus framework of care coordination in primary brain tumors that reflect the unique challenges of people living with primary brain tumors.